Alrighty. Hi, Morgan. I'm Brittni, and I'm the clinician that's going to be doing your telemedicine encounter today. Before we begin, I just wanted to let you know that this is a safe space, and there is no one else in this room around me or in front of me. So that anything you say does not leave this room or this call. And also, I'm going to be looking down and taking notes. So I'm paying attention, I promise. But I just wanted to let you know ahead of time. All right.
Sounds good.
Okay. Cool. All right. Well, go ahead and just tell me a little bit about what's going on today.
Yeah, so a couple days ago, so I'm a volleyball player at my university, and a couple days ago I took like a weird step at practice and kind of just started noticing I had like this weird foot pain, and it hasn't gone away. Like I thought I could kind of just like get over it, and then it's kind of been annoying me like during the day too. Like once I get into practice and get going, it's not like, oh, I can't walk, but it's definitely not comfortable.
Okay, got you. And have you ever injured that foot before or any pain like this in the past?
No, never this foot or anything like that.
Okay, gotcha. Have you injured your other foot in the
No,
past?
no, I
Okay,
haven't.
okay. Um, and what would you rate your pain level on a scale from 0 to 10, 0 being no pain at all, 10 being I need to go to the hospital?
I'd say it's like a 6 at worst, but like if I'm walking, it's like a constant 3.
Okay, got you. So what makes it feel worse, that 6?
Like if I like push off like any more than like a normal walk push off, or if I jump, obviously, that type of stuff, like that motion.
Okay. And have you been able to practice since then?
Yeah, I've been practicing and everything, and like I just ice after, and it kind of feels better after, but
Okay. Do you feel like you're able to practice at your normal 100%, or do you feel like you're overcompensating or changing your practice?
I'd say I'm probably compensating. Like I'm probably at like 90% or 80% with that
Okay.
side, but it's not
All
like
right.
crazy.
Okay. Alrighty. And so, have you talked to anyone about this injury or situation
Not
before me?
really. It's only been like 2 or 3 days, so
Mhm.
it's not. I kind of was just hoping it'd go away. So here we are.
Okay. Gotcha. So, what would your goal for today's conversation be?
Ideally, like for you to kind of have an idea of what it is, because I feel like I haven't heard of like this type of pain before. I guess it's like in a
Okay.
weird spot.
Mm-hmm.
So I guess that'd be cool, and then maybe just ways that we can make it so I can practice. Like I'm a senior and I'm just trying to finish my season, so
Right. Okay, sounds good. So as far as the pain goes, can you try to describe what the pain feels like to you?
yeah, it's like a sharp pain, like, and it's not in my toes, it's like right before my toes, which I feel like is super weird, and it's kind of sharp, and then every once in a while if I step just right, it'll be like tingly too, like just into a couple of my toes, but then it will go away
Okay.
right away. That's the weird thing, is it's not like sore after stuff, it's like during it hurts, and then I'm like I forget about it if I'm sitting.
Okay. So when you say before your toes, so if your toes were like these, would you say before here or in front?
Like my foot, like the foot part, like before you hit the toes. Does that make sense?
Okay. Okay, got you. All right, sounds good. So have you been able to bend your toes, kind of curl your toes? Is that painful?
Yeah, like curling them down like into the ground is pretty okay. It's
Okay.
really just if I like push off, like if I am doing like a calf raise, like that type of motion.
Okay, got you. Sounds good. But you're not having any pain anywhere else in your foot, just kind of right there on your toes?
Yeah,
Okay. And is it like a shooting pain or like a radiating pain?
it's like pretty sharp when I do the wrong movement, and then it's like I said, every once in a while it'll be kind of tingly, or like I guess that's the best way to describe it, like shooting
Okay.
slash tingly just into the toes that line up with it.
Okay, sounds good. And which toes would that be that you say?
It'd be like your middle toe and your ring toe.
Okay, got you. Alrighty. And are you experiencing any numbness or tingling at all?
I mean, like I said, like when I do that certain motion, every once in a while I'll get it, but overall no. Like it's not like a constant by any means or anything like that.
Okay, got you. So if you were to like take a pen or like your finger or something, and are you wearing shoes right now?
I'm not.
Okay, sounds good. So what I want you to do is I'm gonna tell you where to like run the pen or your finger on your foot,
Hmm.
and then I want you to do it on both feet, and I want you to let me know if you feel a different sensation compared to each other. Does that make sense?
I got you. Yeah.
Okay, cool. So, what we're gonna do, so the first one I want you to do is where your big toe is. I want you to run the pen along the like in the side of your foot, like that your big toe is on, if that makes sense. So in the middle of your body,
Hmm.
that toe, and along that side of your foot.
Hmm. Okay, I did it.
Okay, and then did you do it on the other side?
Yes.
Okay, do you feel any change
No,
or
it feels
notice difference?
no.
Okay, sounds good. So now I want you to do it on like the top of your foot going down.
Hmm. I'm doing them both at the same time because I have two pens.
Perfect. Sounds good.
Okay, that's the same.
That is the same. Okay, so now on your outside of your leg, I want you to do like the outside of your ankle down to like your toes, but
Okay.
on the outside of your
Am I
body.
supposed to go like over the bone or like behind the bone? You know what I mean?
Yeah, go do both for me,
Okay.
but it's behind the bone.
Okay. So that's over the bone. That feels the same. And then behind the bone, that feels the same to my pinky.
Okay, sounds good. So while you're down there by
Mhm.
the bone, kind of what I want you to do is just kind of tap around the side of your bone and let me know if you feel any difference.
Like between my left and my right.
Yes.
No, that feels normal. I'm doing like right behind the bone, right? That's what you said.
Okay,
Yeah, that
sounds good.
sounds the same.
Alrighty. So now we're gonna go on to the kind of the next thing. So you said that with your push off, you're having pain. So what I want you to do is, if you have your ankles like out in front of you,
Mhm.
I want you to try to bring your toes up to your shins. Like it obviously it's not gonna go all the way up,
Mhm.
but I want you to kind of just bring it up.
Like just my toes or my ankles too.
Yeah, kind of like your ankles. You're going to
Okay,
be
like the whole
bending
my
at your
whole foot
ankle.
should move, not just my toes.
Correct. Yeah,
Okay, that feels fine and
that
normal.
does. Okay, so then if you were to push down like a gas pedal, like into the ground with flat feet,
Yeah. So if I do like a calf raise from sitting, is that what you mean?
yeah.
So when I do that, like I get that pain in by my toes, but like
Okay,
it's not
got
bad
you.
because I'm sitting, so it's not a whole lot of weight on
Okay. And so then if you were to kind of like turn your feet in,
it. Hmm.
um, so kind
Like
of
my
what I
big
want you,
toes are going towards each other. You mean?
yes. Mm-hmm.
That feels
Kind of do
fine.
that. That feels fine. Okay, so then go out the other way.
That's fine too.
Okay, cool. Are you able to do like a circle with your ankle
Yeah, that's fine both ways.
both ways?
Yeah.
Okay, sounds good. Cool. Alrighty. Are you like right now when you're just sitting, are you having pain?
No.
Okay. So, to recreate that pain, if you were to curl your toes right now, is it gonna be the same pain that you've been experiencing?
So curling my toes doesn't really do it.
It's the pushing off part.
It's the pushing off part, yeah. Like the
Okay, got you.
yeah.
Okay, so now what I would like you to do is so this if this is your foot, can you
Mhm.
take your hand and I want you to like squeeze it and
Like
then release.
from what closer to the toes or closer to the heel.
Yeah, so if these are your toes, like where my fingers are, I want you to squeeze the top part, like kind of where you're feeling pain up there. And I
Mhm.
want you to squeeze it, let me know if that's painful, and then release it and let me know if you increase or decrease pain.
Yeah. Yeah. When I squeeze it, I definitely get like some of that like sharp pain. It's not like the tingly pain that I get sometimes, but it's definitely
Hmm.
sharp. And then when I let go, it pretty much goes away.
Okay, sounds good. So if you were to like your bones in your feet, if you were to just like tap your bones, are you having pain over any one of your like bone digits?
I don't think it's over the bone. It's hard to tell because like it's close, you know,
Hmm.
but I don't think it's on the bone. I hope it's not on the bone.
Okay, sounds good. But as far as your strength goes in your foot, do you feel like you're stumbling or like there's a lack of strength in your foot?
I don't think so. I definitely feel like I'm walking a little different because I don't want to push off as far as I probably should, but it
Okay.
hasn't like I don't think it's weak. I just think it's I don't want to hurt myself.
Okay. So probably the next thing I would like to do is a gait analysis, and that's kind of looking at how you walk because I kind of want to see if you're overcompensating or changing something. So is there somewhere that you could like set the camera up and I can like watch you walk?
Yeah,
Okay,
you can do that.
cool. Perfect. Yeah. So if you just like walk towards me and then walk away from the camera as well.
Okay. Am I in the camera? So it's my left side. I don't know if I actually said that yet.
Okay, sounds good.
What I'm doing here. All right.
Yeah, go ahead.
So I just like don't want to push off. Do you want me to walk?
Okay. Okay.
Do you want me to go again?
Yeah, just you can come this way and then get the camera.
Okay.
Okay. Sounds good. Um but you feel like it's totally fine like lifting your feet up like from your ankles. Like you're
Yeah,
able to
my
do that
ankles.
equally
Yeah.
both sides.
Yeah.
Okay, sounds good. Alrighty. So, kind of at this point, I had a couple thoughts. I was thinking that perhaps you might have like torn a ligament or sprained a ligament in your foot, and it's kind of hard to do like a manual muscle test over this platform, obviously. So that's kind of what I was asking you if you could like come up and with your feet and like go down. I was just trying to see if there was like a difference in your strength there. But as far as this goes and this conversation goes, it seems as though you're fine with your strength. The thing that I'm kind of leaning more towards is you're having some sensory issues, and there are like little nerves and within that run within your feet, and kind of when you squeeze and that increase pain and then let go and it release pain, I'm kind of thinking that potentially you are having some compression of one of those nerves in your foot, because when you released it, the feelings kind of went away, that pain and that pressure, and just kind of how you're presenting to me, that is kind of what I'm thinking right now. And with that, we can do a couple different like tape jobs in like before practice and see if that helps you, if like the compression kind of helps you remove the pain.
Mhm.
And then from there we can try to see if there's anything else we can do, as far as just analyzing your foot more in person and seeing if we can try to like loosen up anything. You said you had no prior injury of a foot injury or anything like that, so I'm not thinking it's scar tissue. I'm just kind of thinking that there's something compressing in your foot. So it's called like Morton's neuro, and it's kind of along those lines of just something that we have to figure out what works best for you and how to avoid that pain. So at this point, that is what I'm believing is going on with you. Do you have any questions? I know that's kind of interesting concept.
Yeah. I mean, it makes sense, I guess. Like, obviously, I don't know what a Morton's neuroma is, but I guess I do now.
Yeah.
And then I guess my only question is like, am I good to keep practicing? Should I like not be going? Like, or should we try the tape job? Like, whatever you think is best. I just like I'd rather miss a practice or two so I can play in games than.
Yeah. No, absolutely great point. So kind of that's why I was looking at the lower quarter screen, which is basically evaluating you neurologically. And you're saying that there's only certain times when you're having radiating pain. And so that is what I was like a little nervous about, which is why I would like to do a tape job on you. But as far as everything else goes, you're not experiencing any numbness or tingling anywhere else in your leg. So I'm not too concerned that you are going to like injure yourself further. The only thing that I am concerned about is you are changing your gait and how you're walking and playing due to the pain. And that's what I don't want you to do.
Yeah.
So that is why hopefully I can see you before practice today and we can like evaluate and do a tape job in person and see how that goes. And then from there we can just like reevaluate going forward. But that is the thing is if you need to sit out today, we can, but I would like to try to get that pain removed and then see how you're walking or playing, and then we can put you into full practice, if
Okay.
that makes sense.
Yeah, so it'll really just be like if the tape job helps, then we probably are good and we'll just kind of play it by ear from there.
Yeah, that's kind
Okay,
of what I'm thinking. Obviously, if something changes, then we'll reevaluate and change it up. But at this point, that's kind of what I'm thinking.
sweet.
Okay. Do you have any
Sounds good.
questions going forward?
I don't think so. Hopefully I can see you today.
Yeah, hope so. I'll have office hours and athletic training facility hours this afternoon, just right
Mhm.
before your practice. You can stop by whenever.
Sweet.
Cool. Awesome.
Thank
All
you so
right. Yeah, of course. Well, I'll see you later today, okay?
All right, see ya.
Bye.